It's a first for the state of Iowa. Mercy is opening a new telehealth clinic next week on the Rockwell Collins campus in Cedar Rapids. This is the first such employer-based medical clinic utilizing telehealth diagnostic technology in the area. And joining us live this midday to tell us more about it, Dr. Tim Segers, Medical Director for Mercy Care Business Health Solutions, and, of course, one of the Mercy Care providers who's going to be seeing patients remotely from this new clinic. What a great idea. It's such a cool concept. Tell us a little bit more about how this is all going to work with Rockwell.
Well, telemedicine has been around for well over 20 years, but it has matured a lot in the last several years with the advent of cheaper healthcare technology. What this provides for Rockwell is an opportunity to provide their employees with access to healthcare with a much lower cost point. It provides full spectrum primary episodic care for illnesses and acute problems on their campus, so their employees don't have to travel to the hospital, to an urgent care and emergency room. And at the other end of the technology is a licensed provider who can do basically a full exam via the technology. There's instruments and other HD cameras on the employee end at Rockwell that allows the physician to see and examine the patient from a distance.
So it's not like just like an iPad where you'd be Skyping with someone. It's a little bit more high-tech than that.
Sure. Although there is a high-definition video visit as part of it, while the patient's interviewing with the provider over the high-definition camera, there's a nurse on scene or on the site at Rockwell who's performing an exam at the direction of the provider. And while the nurse on scene is examining the eyes, the mouth, the ears, even listening with a Bluetooth stethoscope, the provider is watching and listening to all this via the technology.
So you can still get the vitals and things that you need to know.
Sure. It's much like a traditional office visit. It's just done from a distance. But quite frankly, the technology has matured and is so advanced. The physical exam is almost better than someone can do in person because of the way that the computers augment the HD vision, the HD photographs, and the stethoscope.
So now, what types of illnesses would this be a good remedy for?
This technology is good for about what 80% of an urgent care doctor or a primary care doctor does every day. Upper respiratory illnesses, rashes, skin lesions, coughs, colds, sore throats, eye problems, a wide variety of things. Most of the things that the average person would see an urgent care doctor for off hours can be delivered via this technology.
Okay, but for a real emergency, you would still want to obviously seek...
Sure. If it's an emergency, you belong in the emergency room, and this clinic will not take the place of an emergency room.
But for everything else, it sounds like a good solution. Do you think that this is going to be a model for healthcare in the future?
Sure. I think a large part of what primary care and urgent care delivers in the next 5 to 10 years will be delivered remotely via technology. And the spectrum of delivery for telemedicine has grown tremendously just in the last 2 years. So I think this will be a large part of what traditional healthcare does moving forward.
All right. Well, Dr. Segers, thanks so much for joining us today.
You're welcome. Thank you.
Good luck with the clinic. It sounds like a great opportunity.